Did you know that a child's baby teeth are just as important as their permanent adult teeth? Pediatric oral hygiene has become one of the most popular topics in pediatrics today. Thus, we as a group will discuss the importance of oral hygiene, the anatomy of a child's mouth, and how it changes with age, the benefits that pediatric dentistry provides, and the differences between pediatric and adult dentistry. First, I will explain the importance of oral hygiene in pediatrics. Tooth decay can actually occur when a child's first tooth erupts. Parents may question why they should be concerned about decay in baby teeth because they will just be replaced by permanent teeth. However, the problem is that decay in primary teeth could cause a greater risk for decay in permanent teeth. If decay becomes severe, it can actually harm the child's overall health. So what causes tooth decay, you may ask? Bacteria in the mouth actually change the sugar in foods and drinks into acids. Each time a child eats or drinks, this acid can attack the teeth for 20 minutes or longer, which can lead to tooth decay. Children are at a higher risk for decay if their teeth are exposed to sugar often. For this reason, babies should not be put to bed with a bottle. If your baby falls asleep with a bottle in his or her mouth, the liquid can pool around on the teeth. Research estimates that nearly 3.5 million U.S. children are put to bed with a bottle containing something other than water, according to the American Dental Association. Although most incidences of this happening were more common among parents with limited education, about 1/3 of the parents with education beyond high school also place their children at risk of premature tooth decay by putting them to bed with a bottle. Liquids such as fruit juice, soda, and other sweetened drinks contain high amounts of sugar. For this same reason, children should not be allowed to constantly sip on sugary drinks or eat sugary foods. It is recommended that a dentist examines a child within 6 months after the first tooth erupts and no later than the first birthday. Many parents ask why it is necessary to schedule a visit so early, but the main reason is for a well baby checkup for the teeth, just as you would for a well baby checkup at your pediatrician. Besides checking for tooth decay and other problems, the dentist can show you how to clean your child's teeth properly and how to evaluate any adverse habits such as thumb sucking. Two important ways a dentist can prevent cavities include fluoride treatments and dental sealants, a coating that protects the chewing surfaces of the back teeth. Each child has different oral health needs, but it is almost always true that preventative care from your dentist can save time, money, and teeth.
Next, I'm going to teach you about the anatomy of a child's mouth and their primary teeth, which are their baby teeth, until they get their adult teeth. So this is a diagram of a child's mouth. First, they get their central incisors on the bottom, and they get those between 6 and 10 months, so those ones are the first ones to come in. Then on the bottom, again, they get their lateral incisors between 10 and 16 months, their canines or their cuspids between 17 and 23 months, their first molar comes in between 14 and 18 months, and then their second molar comes in between 23 and 31 months. They can lose these teeth, their incisors between 6 and 7 years old, their lateral incisors between 7 and 8 years old, their canines or cuspids again between 9 and 12 years old. Then their first molar they lose between 9 and 11, and their second molar they lose between 10 and 12. On the top, they get their central incisors, these ones, between 8 and 12 months old. Then they get their lateral incisors between 9 and 13 months. They get their canines or their cuspids on the top between 16 and 22 months. Then they get their first molar between 13 and 19 months. Their second molar between 25 and 33 months. So these ones are the last ones to come in. Then they can lose these ones, the central incisors between 6 and 7, their lateral incisors between 7 and 8, their canines between 10 and 12 years old, their first molar between 9 and 11 years old, and their second molar between 10 and 12 years old. When a child reaches 4 years old, that's when their jaw and their facial bones start to grow, and then that creates more room for their permanent teeth, which is definitely a greater amount. You can see here an adult mouth has 32 teeth. They can get their third molar, these back ones, which is also the wisdom tooth, between 17 and 21 years old. Then they get their second molar up here between 11 and 13, their first molar between 6 and 7, second premolar, which is a second bicuspid, between 11 and 12. Then they get their first premolar here between the ages of 10 and 12. Their canine or cuspid between 9 and 10 years old. Their lateral incisors between 7 and 8, and then their central incisors between 6 and 7. So these are the first teeth to come in.
Tips for a positive, child-friendly dental visit. Going to the dentist can be a very scary process, but here are 7 things that the dentist does to make it not so scary. First, they use non-threatening language and body language to make you more comfortable, such as having a smile on their face and using common words that won't scare or confuse you. Second, they tell and show you what they are going to do before they actually perform it on you. Third, they use new and not so new inventions which can make a dental treatment more enjoyable. Fourth, they make the room more comfortable by hiding dental instruments as much as possible, use friendly color schemes, and have music playing in the background. Fifth, they can use some type of sedation drug to make you feel more relaxed. Sixth, they take frequent breaks so that you have time to prepare yourself and to help you relax more. Seventh, they always use positive reinforcements such as you should brush a little more rather than your teeth look really bad. It probably seems like these steps are minor, but in the end they can make a really big difference. Going to the dentist is just as stressful for kids as for adults, but here are some things that can help make your child feel more comfortable. You can find a dentist who has experience working with kids with special needs. Talk to your dentist ahead of your child's appointment to address concerns and keep up with your regular cleanings. There are even pediatric dentist offices which are being promoted nowadays over general dentist offices. Pediatric dentists are general dentists who have completed 2 or more years of training after dental school. They receive a detailed education in child development, orthodontics, and child psychology. A pediatric dentist uses special equipment for children such as small x-ray film and smaller drills. Some pediatric dentists see patients until the age of 16, while others treat them right through the college years. Pediatric dentists are trained to work with children, which can help your child adjust and get comfortable to a normal stressful situation.
Now, I will discuss the differences that pediatric dentistry provides. It's important to educate children about how to properly take care of their teeth. There have been programs funded to not only educate, but provide oral care to children. A health program between the University of Missouri Kansas City School of Dentistry and the Olathe School District in the 2008-2009 school year was created. The program worked to provide school-based services to disadvantaged children in 4 Title I schools. The Miles of Smiles Clinic brought portable dental equipment to each school. 28 hygiene students provided prophylaxis, radiographs, sealants, fluoride varnish, oral health education, and nutritional counseling to 339 kids at the start of the school year. At the end of the year, 11% had begun to seek restorative care at a safety net clinic from a local dentist. There are so many adults who simply can't afford to go to the dentist. According to a population-based survey of adults in central Harlem, New York, from 1992 to 1994, those who had household incomes of less than $9,000, were unemployed, or lacked health insurance were more likely to report oral health problems than those who were privately insured. The most common problems reported were problems with teeth or gums. The oral health status of the U.S. population has greatly improved over the last 30 years. But there are still profound and growing disparities among certain populations. The most disadvantaged are people of color, working class poor, and people with chronic illness or disability. Thus, we can conclude that pediatric dentists play an important role in the growth of children's teeth and promoting good oral hygiene. Thus, we have covered the essential concepts of oral hygiene and the anatomy of the child's mouth and dentition. We have also discussed tips for a friendly visit to the pediatric dentist, as well as the differences that pediatric dentistry provides compared to adult dentistry, including educational programs that promote good oral care and problems that adults may encounter from poor oral care during childhood. By having a better understanding of the basics of pediatric dentistry, parents can make knowledgeable decisions regarding their child's oral health.